Hello everybody,
Hi everyone.
I'm Nat Jones and I'm a clinical academic occupational therapist and I'm currently seconded to a role in the integrated care system as workforce lead and also a programme manager for Ageing Well.
My name is Jennifer Reid and I'm a researcher and occupational therapist based at the University of Sheffield.
And we are here today to tell you a little bit about our digital research project, which has been led by occupational therapists. So we're going to start by telling you a little our story, where we evolved from, and it started back in 2014. So a few years ago, a group of occupational therapists got together to have a think about how we could be more research active as an OT department. And we had a collaboration with the Sheffield University Centre for Assistive Technology. And what we did was we invited a technologist into OT practice to come and find out from OTs what are the clinical challenges that we're facing and have a think about technology and digital development. And from that project, which was called Cabot, we developed a project to think about doing home visits differently. As one of the difficulties OT said about doing home visits was the time and the resources. And so we started to think about, was there a digital solution? And our links with the technologist Peter and the University of Sheffield brought us together with the computer scientist department. And our professor that we work with, Fabio and Vita, who work in that team, they had been using some technology in Italy with the Italian emergency services, and they thought this technology was adaptable for the NHS and could be used to solve our home visit problem. So together we worked with them to develop the home visit, remote home visit. We call it the home visit app, but it's not actually an app, it's a piece of software, and the software enables an OT from the hospital with the patient to have eyes on the home environment. So how it works is a message goes from the hospital to the person's phone in their home, and they open up the message and start a teleconferencing conversation. So it's using things like Skype and things that you'll be familiar with, but the feature of the home visit software is that the OT can write the home visit report while she is conducting the home visit. You can take photographs, video, and also you can even turn on the torch of the person's phone in the home environment if the room that you go into is dark. So that's kind of what the home visit app is, and you might be able to view a video that we've sent along to see the home visit app in action.
So once the idea for the project was born in 2014, we then started developing. There's 3 projects, and the first one was in 2016, where we wanted just to develop the prototype technology and see how it could adapt to the home visit situation. So what we did is we had 3 or 4 simulated home visits. So they were not real clinical home visits, but we went to my home, for example, or the technologist's home. An actual OT went, and then the OT at the base, which was at the base at the university at that time, conducted a home visit via the OT at the simulated home. And we got feedback about kind of what was working well, what didn't work well, how the technology needed to be adapted. And we developed a protocol for its use because we found communication required a protocol, and to be able to do the home visit accurately required a protocol as well. So that was all in Project 1, which was undertaken with about £3,000 or £4,000 worth of funding. And then that led on to the second project, which started in 2018, and that was a 6-month project where we expanded the researcher team. So it was the University of Sheffield, Sheffield Teaching Hospitals, the Community Trust in Sheffield, and Sheffield Hallam University and the council. And we explored acceptability with stakeholders of all disciplines, not just OTs, and ideas of where else this technology could be used.
We did a literature review, didn't we? And an OT led that literature review as well.
Yep. And then that led on to a bid that we put in at late last year that we've just found out. It was earlier this year where we've just found out that was successful, and that's for £50,000. So that's the third project where we're developing the idea even further. And what we want to do in this project, it's a 6-month project, it's starting around about now, and we're going to trial it in 2 or 3 actual clinical settings. So take it out to health and social care settings and try it and see what works, what doesn't work, and just get some feedback really in order to inform a larger bid which we want to put in next year to the NIHR for something round about £250,000 to take it even further. But the idea of this project is just to get the evidence that we need in order to inform that bid.
So we wanted to share with you a little bit about some of the barriers that we've come across doing digital research. So there are a range of things, and here are our sort of top 4 barriers. So the first one is language, what I like to call a sort of translational problem. So we've got lots of languages in our research team. We've got a clinical language, an NHS language, an academic language, a computer science language, and we all talk those different languages. And when we work together as a team, it's really important that we're all on the same page, that we understand the context that we're talking about, and that we understand each other's language. So that has been occasionally a challenge for us, but how we've got around that challenge is by having regular meetings and project meetings together, so that we can check out with each other our understanding of different things, and we can also ensure that whatever we do and develop is embedded in clinical practice, and that it will work in the clinical setting. It's really important to us that what we develop is going to be usable. So our second barrier has been time. So you want to get something up and running and deployed, but you realise that in order to do that it takes time and funding and development, and that hasn't happened at a fast pace, but for us it's happened at a steady pace. And there have been times of intense work on the project and times when we have been not working on the project and thinking about where's our next funding coming from. So we've had to be patient, have resilience, and really be tenacious in our pursuit of this development. Do you want to say about the governance?
Yep. So a key issue that was raised in all 2 projects we've done so far, and we're going to address in the third one, is data governance issues. That's a key challenge for us because obviously anything digital working in the NHS and social care has a lot of ethical and data governance issues that we need to address. So we've highlighted these as a potential, well, not potential, there is an actual challenge, and the way we're trying to address them in this third project is by dedicating a whole work stream of the project to exploring the digital challenges, the ethical and governance challenges of working digitally. And so we're engaging the IT leads of the organisations in doing some work, really drilling down into what the problems are, how they can be solved, are they solvable, that kind of thing. So that's a real issue that we need to kind of
It was the
address.
biggest concern from the patient representatives and from staff is this connection secure? Is it going to be hacked? Is my personal information going to be safe? So we need to pay special attention to that, and we have spent some time doing some technology resilience testing to ensure that there is safety around that.
And we're wanting to transfer information in an ideal world between health and social care and other potential third sector voluntary organisations. And again, that transfer of data brings with it governance issues that we need to address.
So our fourth barrier has been around OTs and their perceptions of this application and what it might do to impact on practice.
So people were feeling very anxious and worried about how that might change, threaten their role as OTs and affect quality of what they do as OTs. So to address this problem, we are trying to really get to grips with what it is they're worried about, the anxieties, and build in mechanisms for evaluating any changes in role or any changes in quality, because we actually feel it could potentially add to quality and add to our roles, but we need to measure it and just see what changes are occurring.
Yeah, so we're now going to share with you our top 5 facilitators of our digital project. Firstly, we feel it's very important to keep it real. Whatever we do is grounded in the real world. So what's going to work, what's not going to work, and we've ensured throughout each project that we've had clinical engagement. And if we come up with an idea that clinicians think is a bad idea or is never going to work, then we listen to that. Our second facilitator is patient stories and patient engagement. So we have engaged widely across health and social care with users and listened to what they've said. And surprisingly, they have said that they like the idea of this digital technology and they can foresee how it can be helpful to them. And also they had other ideas about how it could be used, for example, to reduce outpatient appointments. So it's been really great to get that feedback, and for us that's an important facilitator.
We felt that another key facilitator was the team that we developed, and it was multi-organisational and multi-skilled. So we were working across health and social care and the both universities in Sheffield, and we feel that is a really huge strength because we can draw on a huge number of skills and experience and expertise in order to develop the projects and move forwards. We've accessed the Research Design Service advice, the RDS advice at university, in order to help us build or think more strategically about how we develop the project over the years and what we need to aim for next and what evidence we need to create in order to get our next pot of money. So that's been quite important, and thinking strategically about linking in with NHS kind of aims and
yeah, I mean the fifth top tip really is think strategic, and we didn't perhaps set off thinking strategically, but we've learnt along the way that that's really important. How does what you're developing fit with the long-term plan? How does what you're developing fit with your integrated care system strategic plan and your local place plan? And really starting to think about that and what the benefits for that would be for delivering those plans. So I think that's something we've definitely valued as we've gone along, is gaining more strategic thought into the team.
Yeah, and that's been key in we feel in getting success with funds.
Yeah. Okay, so we're now going to share with you a little bit about the benefits of the technology.
So obviously the technology allows things to be done in a more, we feel, efficient way, and all the stakeholders we've engaged felt that as well, saving money, time, and doing things more effectively. We feel it's got the potential to be more patient-centred and involve patients in decision making. So at the point of discharge, we can go to people in the hospitals or in the clinical settings and engage them in the visit and engage them in the decision making process in order to discharge them. And it's also, the technology's got the potential to share information, like we talked about earlier, across organisations and across between health and social care and health and voluntary sectors, etc. So that's got a massive potentially good benefit.
Yeah, I'm thinking about the benefits now for workforce. One of the things that Jen and I, as OTs, are really being keen on is with every project, enabling other OTs to work with us on the project. So we offer secondment opportunities in each project, and those OTs have developed their research skills, but also what we're trying to do is broaden research within occupational therapy and think about digital opportunities. So some of what we've done is supported people to come on the project, and as a result they have gone on and done other research projects as well, so really building that capacity. The other thing that we've done is develop networks, so through presenting at national conferences, through working in this digital area and working with academic organisations, we've built our networks as OTs around research, and I think as well raised the profile of OT in this area. This year we had the opportunity to go to Italy to present at the European Assistive Technologies Conference about the project, and we've really been out there as on a profile on social media and raised the profile of OT and research in the digital area. And what we've also done through this project and through the stakeholder engagement that we've done is get people thinking about digital, not just about this project, but about using apps and iPads and other technology. So raising that awareness and creating a readiness of the workforce to embrace digital technologies.
On a personal level, we feel that the benefits of engaging in this digital project have been developing our own personal research skills and our knowledge of technology and digital innovation. We've developed new collaborations nationally and internationally. We've undertaken presentations, again, nationally and internationally. We're working on papers and bids and being successful in those as well, relating back to the project. And we're building our own sort of profile as OTs and academics engaging in research, digital research.
And this year, from attending the conference in Italy, we've now established a connection with OTs working in the Netherlands, and they are very keen to try the technology that we've developed and follow the same process we have for user engagement. So we've now got a potential collaboration there, so we've gone international as well. So we'd probably just like to finish off by saying hope you enjoy the day, and sorry we couldn't be there, but hopefully this little video will suffice. Jen and I are more than happy to be contacted. Susie will have our contact details, but our sort of key messages are: don't be afraid, go out there, seek the opportunities, get involved,
and develop a team. The team is invaluable. Because it keeps you going,
I mean,
and it gives
Jenna,
you skills.
We are not computer scientists by any stretch of the imagination, but I think through having that really good, strong team, we have been able to collaboratively bring this project into practice, which is really exciting.